The Government has received the Royal Commission into Aged Care Quality and Safety. The Commission is divided on governance and funding issues. This is an extremely unusual outcome. Royal Commissions tend to provide unanimous recommendations. We will focus on two areas discussed by the Commission: the creation of a rights-based system of healthcare and the dualling government structures proposed by the Commissioners. Drawing on international human rights documents, the Commissioners propose a system of aged care based on the universal right to high quality, safe and timely support and care through these recommendations. The pivotal recommendation is this one. What could fall into a general duty is extremely difficult to identify. Now, we've had experience with legislative schemes that establish these sorts of general duties. It is not inconceivable that the ambit of what constitutes a breach of a general duty could be discovered by the Federal Circuit Court as it makes rulings on civil prosecutions. In these circumstances, courts and tribunals typically look at specialist documentation to gain some understanding as to what a compliant healthcare provider should provide so as to comply with a general duty. Now, this will be particularly important as the duty requires the delivery of high quality care, something that's pretty subjective. Is there a real material difference between high quality care and adequate care? To conclude, the Royal Commissioners said this: the transition from a consumer to a rights-based model of aged provision will be interesting to see. Now, patient's choice is recognised in the report. The word choice appears 81 times, and the word wishes appears 9 times in volume 3A of the report. However, in a scheme that has at its base a requirement to discharge a very broad general duty, accompanied by a plethora of enforcement tools that are available to regulators to encourage compliance, a possible unintended consequence could be the development of an health and safety view in which providers aim towards abstract compliance according to the manual. That is, whatever document is considered best practice for a particular activity rather than patient need. The Commissioners differed on the issue of the governance structures for aged care. Commissioner Briggs's model was a stewardship model, vesting governance responsibilities with the Federal Department of Health and Aged Care. One presumes that a stewardship model is one in which government acts as an active and ethical trustee of public health, dedicated to developing the collective health commons. Commissioner Briggs thought this: Commissioner Pagoni has proposed the establishment of a specialist Australian Aged Care Commission, which will act as an independent champion for high quality and safe care, rather than have decisions made by the very people who must compromise between competing government and political priorities. Now, this form of commission will discharge these sorts of functions. Now, in our view, this model looks pretty much like the ASIC, or the Australian Securities and Investment Commission model that governs the corporate space. Commissioner Pagoni also thought this: A specialist body may attract people experienced in and dedicated to delivering quality aged care and developing aged care policies. It's our experience that governments treat public sector administrative ability as a generic skill that can be transferred from department to department. There is no sign of any change to this view. And so the more talented officers move around to seek promotion, which is in fact something that Commissioner Briggs seems to concede when she says, however, that said, it is unlikely that an independent aged care commission would act as both system regulator and champion of aged care recipients. Irrespective of policy sector, regulators generally don't tend to champion those that they serve, as that usually means having to acknowledge shortcomings and errors. This seldom happens in practice. The championing role will probably fall to the proposed Inspector General of Aged Care, who is charged to investigate, monitor and report on the administration and governance of the aged care system. It will be interesting to see how a rights-based aged care system will be designed. These issues are discussed in greater detail on our blog at www.kmcork.com.au.